Welcome friends, here at Daktari Explains, where we keep it as basic, very basic as is possible. The goal is to equip you, to give you the right information that you need to fight any disease or condition that you could be having or a loved one could be going through. If it's your first time, make a point of checking the previous videos. We've discussed stroke, we've discussed diabetes, we've discussed the importance, we've gone into in-depth study of why you need to be informed. That's a video on its own, so make a point and look them out. We also did diabetes, and today we are going into, so this video today actually is a continuation of where we left off last time. If you watched it, I hope you remember the things we discussed, the risk factors, the symptoms, how one symptom leads to the other symptom, and it just becomes a vicious cycle. The P's, as we call them, the polyuria, polydipsia, and polyphagia, and how we make a diagnosis. So today we are looking at one complication of diabetes. Hello, welcome to Daktari Explains.
The interview is hot.
No single disease or condition that you cannot overcome with the right information. But stroke gives you up to at least 3 hours, but at least if you can get it within 1 hour, the doctor can be able to give your loved one a medication that is able to go and just break down that clot. So what is this complication that we are looking at today? Diabetes foot, which is a chronic complication. By chronic, we mean long term. So many events over time, ultimately giving you diabetes foot. And I've labeled this video, Say No to Diabetes Foot Amputation. Why is that? Is because diabetes foot is one of the main causes of amputations today. No! There are many other reasons people lose their limbs, but diabetes is one of the major causes, and it is avoidable. The reason people will go through amputations because by the time you're coming to the doctors, it's already what do we call a dead limb or a dangerous limb. What does a dangerous limb means? It means that you having that limb is likely to result in death. So meaning that that limb has to be cut off for you to survive. And all this we will understand as we get in the depth of this video, still keeping it as basic as possible. So straight away, diabetes foot is any infection affecting the foot of a person with diabetes or an ulceration. So how does this come about? In diabetes, there are 3 factors that play a role for the ultimate development of this condition. So we have vasculopathy, neuropathy, and immune dysfunction. Yeah, those pathies. Yes. So what does this mean? Neuropathy, neurons. So we are talking nerves. So we are saying that the nerves are affected. That is one. Then we are saying vasculopathy, vascular, the blood vessels. So they are affected. And thirdly, the immune function. Immune is how we are able to fight infections, diseases, and all that, the immune system. So it is affected. So in diabetes, all these 3 are affected for you to actually develop a diabetes foot. Now, I always say let doctors carry the weight of the knowledge. For my goal is to equip you with what you need for you to help yourself in a very basic way. So not all the time that all these 3 have to be interfered with for you to develop diabetes foot. Just the nerves being affected could give you diabetes foot. Just the blood vessels being affected could result in diabetes foot. So, but anyway, these are the 3 main players for you to develop diabetes foot. So what happens in neuropathy, the nerves? The sugar particles in your circulation, let me call them particles to keep it easy. As we said, insulin allows us to take in sugar into cells and they're converted into energy. But for some people, as we say, diabetes 1 and 2, either you don't have insulin because your cells are destroyed by autoimmune. Please, if you haven't checked out my previous video, do that before watching this so that things make sense. So either your cells are destroyed that produce insulin, or your cells are not responsive to the insulin, as in type 2. But for whatever reason, it means sugar is not being taken up in the cells, right? And it means that this sugar gets to remain in your blood circulation. Now, this sugar, they are converted into a certain form now, which goes to destroy all this that we are saying. So in the nerves, so what happens is, as your nerves get destroyed by the disease, diabetes, as we said, it's a chronic condition. So this is not a one-off or an event or acute. It's over a long duration of time. So the nerves get affected, and you realize for people with diabetes foot, as it advances, you stop feeling pain. Initially there's some numbing, and over time, as the nerves die, you cannot even feel pain. This is someone who step on a nail on the side that it actually pricks the sharp end, and they won't even tell. This is someone who, if they're in the farm, they'll step on thorns and they won't know. So what does this mean? Definitely, I'm sure you can, if you're following, it should be making sense. If you're not feeling pain, it means you're more vulnerable to injure your limb. So what happens when you injure your limb? You give room for ulceration. So as simple as I can put it, as basic as that. So you lose your sensation of pain, resulting in you getting a lot of injuries. So that is what we call sensory impairment. You know, nerves carry a lot of functions. Senses, that is the touch, cold, pain, heat, that touch part is sensations. And they also control your muscles so that they're able to function. So you also lose your motor function. What does that mean? The muscles in your feet, they lose their strength and their ability to function. This results in deformities. And if you've encountered someone with diabetes for a long time, it was not well controlled, they start having weird shapes of their digits, that is their toes. So it results in deformities. Oh no. If you have deformities, it means you start walking. It means your legs take a different shape and you start walking abnormally. If you're walking abnormally, means you're very vulnerable to injure yourself. And that's how you develop cuts, you develop ulcers along the legs. And thirdly, still on nerves, you lose your autonomic function. Autonomic means is the areas in our body, the functioning of our nerves that control the glands. So the sweat glands, the bladder, our eating and all that. So in this case, you lose your sweating ability of the legs. So what does that mean? You know, we sweat, ideally, not that you actually see the sweat, but the body has its way of maintaining your skin very soft and moist. So when you lose that, it means you have very dry skin and brittle skin. Now, I'm just looking at my timer and I realize this video will be long, but the main point is for you to understand. So you lose your, what was I saying? Autonomic. You lose the sweating. So you are very dry and brittle. That is easily to break kind of skin. So what does this mean? It actually means you're even more vulnerable to injure any small cut, something that you'd have easily just stepped over and walked. This time now it's easy to cut you and develop ulcers. So all this is just a neuropathic foot, a foot that the nerves have been affected. So your sensations are lost. Your muscle function is lost and you're walking abnormal, what you call abnormal gait. You're having a deformed kind of feet and being more vulnerable to injuries. And finally, you're not maintaining the texture of your skin, making you more vulnerable to injuries. So that is neuropathy. Let's come to vasculopathy. What happens in diabetes? All these sugars that are in the blood, as the blood is flowing through the vessels, they affect the blood vessel lining, so allowing for what we call atherosclerosis, which ultimately leads to what we call PAD, peripheral artery disease. Now, how do I put this in a very simple way? It simply means that as your lining is being affected, a lot of things get to attach in the blood vessel lining. So where there is, I'll put a photo at this point. Yes, so where this lining is affected, because the body has to defend itself, it has to do something about it. It brings a lot of platelets, a lot of fat will be deposited there. So what happens to the diameter of the blood vessels? Gets narrower and narrower. So what that means is the blood flow that was supposed to get to the foot is now not able to get to the foot. So we are having diminished blood over and over, and at a critical point, there'll actually be like cut-off supply of blood vessels to the limb. So this leg will be cold when you compare with the opposite leg, maybe that is not affected. So it will be cold, it will be pale. So these are the symptoms that you need to be looking out for. I hope you picked out the symptoms in the neuropathy. Diminished numbing or diminished sensations, or your skin is getting dry and flaky, or just cuts, what those abnormal disfigurations. So those will be on the neuropathy. On the blood vessels, if your limb is getting cold, pale, these are some of the things that we'll call the symptoms because of a vasculopathy. And finally, immune dysfunction. I need to take some water. So when we talk immune dysfunction, people with diabetes diabetes affects the immune function. How does it do that? Because there's so much of things that should not be in your blood stream. They are now there, the sugars and all that. So it means that what is normally supposed to be in your bloodstream is also affected. I hope you get the logic. So that means that the white blood cells, anytime there's an injury in the body or there is an infection in the body, the white blood cells are channeled to go to that particular point, and it should be at a particular speed. But because this blood is loaded with sugar and all this unnecessary, it means that that delivery of the white blood cells, the antibodies, all of them to destroy that infection is impaired. So bringing all this into one, so we have your sensations are gone, your neurons are affected, so you're very vulnerable to just hurting your leg anyhow with the slightest of things, as we've discussed. Your blood vessels, blood is not being delivered to the limb as it should be, which simply means, it's also the blood that carries the nutrients, the oxygen and all that. So all these are also being impaired to be delivered. And then now your immune system is not able to channel. Your white blood cells are not channeled there properly. The antibodies are not channeled there properly. And this is how diabetes foot ultimately culminates into killing that part of the limb, that foot that we are talking about. So the symptoms are those. So that is diabetes foot in terms of what it is and how it comes about. Now, this is where you need to be equipped. Foot care. The symptoms, we've said them. So foot care for diabetes is as mandatory. We say a diabetic person should take care of their feet like they take care of their face. So, and this is where now this becomes important, because education for a diabetic is a must. You have to know how to take care of your feet. One is a diabetic cannot wear shoes that are not proper for their size. You know how you can just be, a shoe is pressing you just a little bit, but you like it and you wear all those compromising things that we do. This cannot be done for a diabetic. You cannot, your shoe must be the perfect fit, not smaller and not bigger, because either way will predispose you to injury. There are particular soles, rubber soles, I think there are even silicone soles that are used especially for people with diabetes. You can find them and buy. They allow for more padding than a normal shoe will have. Thirdly, and I think this should have been number one, if you notice any cut, any infection, any discoloration, any of these symptoms, run to the hospital where they'll check your sugars, they will stabilize your sugars, and as well as take care of that limb. So any sign of abnormality on your feet, so actually let's just put them in order. That should be number one. Anything abnormal on your limb and you're diabetic, run to the hospital, let it be taken care of. You'll be put on an antibiotic cover. If there's a wound, it will be cleaned and you'll recover. Then secondly, you said wear the right size of your shoe, have the proper inner soles to the shoes. You cannot walk bare feet as a diabetic, because you just don't know what you might step on and all that. Things like farm, you need to be careful, extremely careful. Probably avoid if you can, because this is now once all these things take place, as we've said, immunopathy, vasculopathy, and immune dysfunction, there are organisms that take advantage of that. Like if you're in the farm environment, there's one we call Clostridia. In the symptoms, if you see any swelling, when you see any swelling and you press your feet and you're hearing gas, like something crepitus, gas, that is a sign that you could be having a gangrenous feet, which will actually take you straight for an amputation. So avoid farm environment, soil environment where these organisms are found. If you have, that is what we call a wet gangrene. If you have something called a dry gangrene, you just literally see your leg is turning black and it's dry and all that, literally turning black. But these are, for you to actually get this, you've ignored quite a number of signs. And because by the time you're coming with a gangrenous feet, you are the next one to be booked for surgery for that amputation. So avoid all that. Take care of your feet. Take care of your feet. Have your foot care as proper as it should be. Wash your legs as proper as it should be. Keep them dry. That is, oil them and make sure they're dry, not wet. Don't wear wet socks. All those things that people can just randomly do for whatever reasons. Foot care is mandatory for a diabetic. So if I wanted to pass any information on this video, is that one. So avoid the amputation. In the hospitals, if you come at any stage of this, you just have an ulceration. Most people, it's an ulceration that will bring them. You'll be put on a very serious antibiotic cover and a thorough wound cleaning and dressing that we do in the hospital. And some of these ulcers can be tedious to deal with. So let's agree on one thing. If you see at the tiniest of thing, a little boil, a cut, just have it taken care of, because once it progresses now, the doctors and nurses take full charge of your limb, and the decisions might not be good, may not be easy to make along the way. That is all for today. I didn't think it was actually going to take me that much time. I'm at 15 minutes. Actually not 15. That is around 17 minutes. So pass this information to anyone you know they have diabetes. Let them not ignore that numbness they are feeling in their leg. Let them not ignore that paleness in their leg. Let them not ignore that small cut and put a, what do we call it? Yes. That is it. See you next time.